Have you ever wondered how a basic, run-of-the-mill cold can suddenly escalate into a massive, microscopic medical battleground right inside your skull? Well, welcome to this explainer. Today, we are unpacking the fascinating and honestly sometimes terrifying world of rhinosinusitis.
Okay, let's get our terms straight right out of the gate. You've probably heard people say, "Oh man, my sinuses are killing me. I have sinusitis." But technically, inflammation rarely stays isolated to just the paranasal sinuses or just the nasal cavity, because these spaces are directly connected through some really tiny drainage holes, and infection in one almost inevitably spreads to the other. That's why in clinical medicine, doctors call the whole shebang rhinosinusitis. Here's our roadmap for this explainer. We're going to hit the anatomy of a sniffle, the viral setup, the bacterial takeover, the fungal threat, chronic congestion, and finally, complications and cures. Let's kick things off with Section 1, Anatomy of a Sniffle, and what I like to call the battleground of the skull. Now, let's look at the critical choke point where everything starts to go off the rails. Your sinuses are essentially hollow, weightless cavities in your skull that connect to your nasal passage through a tiny, tiny opening called the osteomedial complex. When that choke point gets inflamed and completely blocked, it triggers four classic symptoms you've likely experienced firsthand. You get that lovely nasal discharge as mucus builds up. You get total congestion because the swollen tissues are physically blocking your airway. You feel intense facial pain and pressure because those hollow sinuses are suddenly heavy and stretched out with trapped fluid. And finally, you might get hyposmia, which is just a fancy way of saying your sense of smell vanishes because the swelling literally blocks odor particles from reaching your olfactory nerves. Moving right along to Section 2, the viral setup, where we see exactly how the stage is set for trouble. It really is like a microscopic domino effect. Say you inhale a standard pathogen, like a rhinovirus. It binds to your cells and starts replicating. This immediately triggers something called ciliostasis. See, you have these microscopic hair-like cilia in your nose that constantly sweep away debris. But the virus paralyzes them. They literally stop beating. Meanwhile, your goblet cells are still working overtime, pumping out mucus to trap the virus. But without the cilia working as a conveyor belt, that mucus has absolutely nowhere to go. It builds up, the tissue inflames, and boom, your osteomedial complex swells completely shut. You now have a high-pressure, trapped pool of fluid locked inside your face. Now, the vast majority of acute rhinosinusitis cases are purely viral. They're incredibly common, but thankfully self-limiting. Usually your immune system handles the heavy lifting and everything clears up on its own in under 10 days. But what happens when things don't clear up? That brings us to Section 3, the bacterial takeover or creating the absolute perfect culture medium. Think of the viral infection as the setup crew. It basically does the dirty work. By sealing off that osteomedial complex, it cuts off the oxygen supply and traps a pool of warm, stagnant fluid. That creates an ideal hypoxic culture medium. It's basically an all-you-can-eat buffet for bacteria to multiply like wildfire. And who moves in to take advantage? Usually, it's these three usual suspects: Streptococcus pneumoniae, Moraxella catarrhalis, and Haemophilus influenzae. Now here's the wild part. These aren't even necessarily foreign invaders. They're natural colonizers that probably already live quietly in your nasal cavity. But once they get trapped in that oxygen-starved, mucus-filled sinus, they go crazy. They release toxins, your immune system panics and deploys heavy-duty white blood cells called neutrophils. The neutrophils start attacking the bacteria. But in the process, they cause intense inflammation, leaky blood vessels, and they turn that clear sinus fluid into a thick, purulent discharge. Yep, pus.
So how do you know if you've crossed that line? It comes down to a classic clinical sign known as double worsening. You get sick for a few days, and maybe around day 5 or 6, you actually start to feel a little bit better as your body beats back the virus. But then suddenly, bam, you get hit with a massive spike in facial pain, pressure, and a high fever. That double worsening is the undeniable signal that bacteria have officially taken over that culture medium.
Now for Section 4, the fungal threat. This is a massive, high-stakes escalation.
Let's be clear up front. Healthy immune systems chew up everyday fungal spores for breakfast. You breathe them in all the time without issue. For these fungi to actually take root, they require a severely compromised host. We're talking specifically about patients suffering from extreme immunosuppression or diabetic ketoacidosis.
But when it does hit, the speed of this fungal cascade is absolutely terrifying. Take a patient in diabetic ketoacidosis. The high acid levels in their blood liberate free iron. To a fungus like mucor, iron is basically rocket fuel. The fungus grows aggressively and performs angioinvasion, meaning it forcibly breaks into the local blood vessels of your sinuses. This triggers severe blood clots, completely cutting off oxygen. The starved tissues rapidly die off, leaving behind these necrotic, black eschars right inside the nasal cavity. It is a massive, life-threatening medical emergency.
Let's dial it back a bit from the emergencies and look at Section 5, the chronic congestion. This is mostly about inflammation, not active infection.
If you've been dealing with congestion for 12 weeks or longer, you're looking at chronic rhinosinusitis, and it usually takes one of two distinct paths. On one hand, you have issues driven by physical blockages, maybe a deviated septum or incredibly thick mucus from a condition like cystic fibrosis. That trapped mucus becomes a haven for stubborn bacterial biofilms to form. On the other hand, you can have chronic sinusitis with polyps. This is actually driven by a hyperactive allergic immune response, like Samter's triad. Specialized white blood cells called eosinophils cause so much fluid to leak into the tissue that the mucosa literally bubbles out, forming a polyp. And the worst part? That polyp physically blocks the drainage choke point, starting the whole miserable cycle all over again.
Finally, let's wrap up with Section 6, complications and cures. How do we break the blockage?
If that osteometal complex remains blocked and the pressure just keeps building, the infection can actually breach the sinus walls. And the anatomy right there is incredibly precarious. It can spread to the frontal bone, creating a nasty abscess called a Pott's puffy tumor. It can easily break through the paper-thin bones separating your sinuses from your eyes, causing orbital cellulitis. And most dangerously, the infection can travel backward through valveless veins straight to the base of the brain, causing cranial nerve palsies, meningitis, or even brain abscesses.
So how do doctors navigate all this? Well, this gives us the clinical playbook, and it illustrates exactly why your doctor won't hand out antibiotics on day 2 of a simple runny nose. For viral infections, you just need supportive care. Antibiotics literally do nothing against a virus. Clinicians hold the line on antibiotics until there is undeniable evidence of a bacterial takeover. For those terrifying invasive fungal infections, we're talking immediate surgery to remove the dead tissue combined with intense IV antifungal drugs. And for chronic congestion? Since the root cause is structural blockage or allergic inflammation, treatments lean heavily on corticosteroids to shrink the swelling or endoscopic surgery to physically carve that drainage pathway back open.
Through all this complexity, if you take away just one number from this explainer, make it 10. 10 days is the biological benchmark doctors watch. If your symptoms clear up before then, congratulations, your body won the viral battle. But if they persist beyond 10 days, or you get that double worsening spike, that trapped fluid has officially become a bacterial battleground.
As we wrap things up today, I want to leave you with this thought. The next time you feel a little sniffle coming on, just picture the incredible, high-stakes anatomy right inside your skull. Will your microscopic cleaning hairs keep the traffic flowing smoothly, or are you setting the perfect, high-pressure stage for a much larger invasion? Thanks for hanging out and exploring this with me today. Keep learning, and I'll catch you in the next explainer.